We're here today to talk about public health, but also to give an opportunity to be able to share some of the great practice happening in Wakefield. Wakefield is one of our more long-standing local authorities, and who are doing some really fantastic work, particularly around data and imaginative ways they're trying to reach out to sections of their local population who find themselves in socioeconomic disadvantage. And we also welcome here this afternoon Matt Matai, who's a paediatrician, and is going to be giving his perspective on the value and the worth and the contribution that 50 Things to Do Before You're 5 can make to a really positive start to life. And that positive start to life is incredibly important. And has always been so, but all the messages that we're getting from the national data, from the NHS Digital, from a number of other sources, is suggesting that big efforts with children under 5, big efforts with supporting health and early learning outcomes have been never more needed because of the impact of the coronavirus pandemic. And we'll pick up some lines of inquiry on that later on this afternoon. Before we just move on into one of those presentations, I'm just going to take five minutes very briefly just to describe what 50 Things to Do Before You're 5 is all about. We have, for those of you using Zoom and have got the viewing bar either at the left or the right, you are able to actually pick up the viewing bar and move it to the bottom of the screen by dragging and dropping it. It probably might give you greater capacity to be able to see the full screen, and I've just done that myself to reveal that we've got Matt Matai here this afternoon from Bradford Teaching Hospitals NHS Foundation Trust, and Angie Gorn from Wakefield Council. 50 Things to Do Before You're 5 is a project, an initiative that's based around the outstanding practice of St Edmund's Nursery School in the Girlington area of central Bradford. Humble beginnings in one outstanding school, but now reaching out right across the country. 50 Things to Do Before You're 5 provides suggestions for parents, which are all of them low cost and at all times fun activities for them to do locally with children, and indeed to a greater extent now with the wider family, with aunts, uncles, grandparents, and whatever that might look like. Whoever are the people who love and care for those children within their familial and friendship structures. So it's suggestions for parents for things that they can do, and those things that they can do have been constructed in a way that they will support improved outcomes in early health, language development, cognitive development, mental well-being, and school readiness. And for colleagues who are interested in only certain aspects of those strands, you can find a place for your work within 50 Things. But for colleagues who've got a more strategic view, 50 Things to Do Before You're 5 helps all of those areas of a child's development at the same time. And it does that through a multi-platform offer localized for your region. It's an app, a website, some promotional materials, and social media campaign support, so that you can have a 50 Things to Do Before You're 5 offer for your local authority, for your local area. And the best way to find out about 50 Things to Do Before You're 5 is to download the app and have a look. 50 Things to Do Before You're 5 started out in Bradford, but is now rolling out nationally. Over 17 local authorities will be part of 50 Things to Do Before You're 5 very shortly, and that's over 500,000 children. 17% of England's under 5 cohort. And those are really powerful numbers from a humble beginning in one school, now reaching out across England, with some really positive conversations now in place and projects advancing in both Wales and in Scotland too. So very much more in next year will be much more than an offer to England. Each local authority that buys into 50 Things to Do Before You're 5 will get access to their own app featuring their own children and own places and own families and own buildings, local information, again with a national template. You get your 50 Things to Do Before You're 5 app, you get your 50 Things to Do Before You're 5 website, and also the range of print-ready resources that you can see there, including the card pack, the poster, and the pull-up banners that you can see illustrated on the screen. And it's very much a local offer. We want it to be an intuitively simple, joyful, easy to access resource for parents. It's very much focused at parents. Regionalized website app and marketing resource templates with images of local children, local assets such as your wonderful museums, parks and services, and an opportunity to promote events to app users through our events pages, and to alert users of the smartphone app through to local events through app push notifications. All the time you're able to gather user engagement data. When a family signs into 50 Things to Do Before You're 5, they put in their fine postcode, they don't put in their name, but our app gathers the details of those local families and their locality, and you're able to use this powerful data set against data that you will hold locally, your index of multiple socioeconomic deprivation data sets, IDACI data sets, and you'll be able to see the families that are using them and the areas that are using them, so that that can influence your local policy. Effectively, that's what we have in 50 Things to Do Before You're 5. I recommend it to you. And for all people on the call today or accessing the call later on, there's an opportunity to find out more from us. Simply get in touch and we'll schedule a Zoom call with you. We'll have the opportunity to be able to speak to you and answer any of those questions. Okay, so I'm going to stop my screen share now, and I'm going to, it gives me a great deal of pleasure to be able to hand on to Matt now, who's going to giving his perspective. Welcome, Matt, from Bradford Teaching Hospitals NHS Foundation Trust, and I'll yield the presentation rights to Matt now.
Thanks, Christian. I'll just try and get my slides up.
And we can see those well, Matt.
Can you see those? Great.
Yeah.
Is that a bit better, that one?
Even better, yeah.
Great. So thank you, Christian and Andrea and Hannah and the 50 Things to Do team for inviting me to say a few words on linking clinical and public health messages for our youngest members of the community and their families. So as Christian said, I'm a general paediatrician working in Bradford Royal Infirmary, and my day-to-day work is really with children who are acutely unwell, who present to the Bradford Royal Infirmary, but I do general paediatric clinics in St Luke's Hospital, all part of the same trust. So I start by saying I'm not a developmental paediatrician, but someone who's been really sort of really likes the idea of this 50 Things to Do project, and I really see a fantastic opportunity working within our communities, really to help in young children's development. So I just want to start by just sort of probably saying things that most of the audience already know, that the brain's ability to change in response to experiences is particularly marked in the first few years of life. Probably the first 5 years, both in neurological development, but also in physical development, the body and the brain are going through significant change. And as most of us on the call know as well, as you get older, change is much more difficult, but the brain can still has still a degree of plasticity and can still develop, but it's much harder. So that's a really key part and key time in our lives to really try and maximize the opportunities for brain development. It's estimated that every second in the first few years of life, that around 1 million new neuronal connections are being made in those first few years. So we're building an architecture, a foundation, which is going to serve that child over the course of their lives. And those foundations can either make a child more vulnerable or actually can build strength. And those foundations are really, really key. And the looking through the 50 things, the various things that are suggested for development, it's building on really key neurological and concepts of the fact that experiences do build brain architecture, but also on the serve and return interactions, the reciprocity of interactions between a carer and a child, and how important that is to build those important brain circuits for the future. And it's all within this sort of nurturing, stable, engaging environment. Because we know that stress in young children can have a really detrimental effect on not just the child's neurological development, but also physical development that we see in children who suffer from neglect, etc. So the 50 things, as a tool, just the concept is amazing. And I was very pleased when I initially saw it, and then delighted to accept the invitation to speak from my perspective. I think one of the things that all of us has faced over the last 2 years is a look at our practice because of COVID. I think COVID has really made a lot of us reflect on what's happening in our communities, in our neighborhoods, but also on the ways that we actually try and deliver care. And just the small graph on the top right is really just to prove or show really the really quite tight correlation between the deciles of multiple deprivation and what we found is COVID mortality risk. And you can see it's not just the poorest do the worst and the richest do the best, but there is a graded worsening according to your inequalities, which is quite interesting. And as many of you are aware, Michael Marmot reported last year on the 10-year review of inequalities in England. And he's produced with a team another report just looking at the effects of COVID, published earlier this year, where he's sort of trying to get us thinking about not just building back, after COVID, but actually building back fairer, because it's fundamental to how we should be trying to think about the next few years. But some of the work really found that during COVID, more disadvantaged children have been disproportionately harmed by closures in early year settings, that levels of development were lower than expected amongst our poorest children, and that parents with lower incomes experienced greater stress when young children were at home. And as many of you know, working in local authorities and education, that many early year settings in more deprived areas have been at greater risk of closure, and many have had to close, unfortunately, and also many have also had to make staff redundant. And there's been a particular knock-on with children who have special educational needs, and again, they've probably felt the real brunt of COVID. And at the end of this report, really, the team who produced the report said that reducing inequalities in the early years should be a priority for government, which is a real challenge for government, and important for us to address working in our areas. I think increasingly, even pre-COVID in the NHS, we've found that a lot of the health issues that we are facing, in the past, we've dealt with it in a very linear way. So, for example, a child presents to my hospital with asthma. I give some health advice, I give some treatment, and then send them home to a house potentially which is full of mold and with parents who can't care for that child for whatever reason in the right way. And it's increasingly becoming in the NHS you know, the topic of discussion. How do we improve care and have a much more collaborative approach with community services to try and improve our children's lot in our communities? In Bradford, as many of you will know, a lot of the issues that we face, for example, child poverty or homelessness or obesity, really we fall in quite the red category for all those conditions. And I'm a diabetologist. It's my specialist training. In Bradford, we are seeing increasing numbers of children who are overweight and obese. So 1 in 5 children in reception years in Bradford are classed as overweight or obese, and almost 10% of children 4 to 5 years old are obese or severely obese. And clearly that's not a problem that we can solve by medicine or by coming to hospital. It has to be a community and a collaborative approach to tackling these, what we call wicked or complex problems. I think for me as a healthcare professional, one of the things that I'm really quite challenged about is that, the research suggests that healthcare, when I talk about healthcare, I'm talking about, hospital care, primary care, sort of community nursing care, health visitors, midwifery services. We can only contribute around 15% to the health and well-being of our population. Much more significant is actually trying to engage with unhealthy behavior patterns and other environmental and social and also economic issues that many of our families face. And I think pediatricians certainly are coming to this realization that we cannot do anything significant for our populations if we don't start to think much more holistically, collaboratively, and also with a focus in the community. And this is where I think the 50 things to do before you're 5 really comes into its own. So, being engaged with healthcare interventions in the hospital, I've been to many, many meetings where we've talked around inequalities and how are we going to reach hard to reach groups. And increasingly, that phrase hard to reach groups is being challenged, completely correctly, because I think we're actually dealing with groups when we're talking about inequalities and how do we reach out to people who quite often we can't sort of or don't seem to be able to engage with. I think there's a real tendency to actually ignore those groups and actually just get on with looking at the families and the communities that actually engage well. And I think that's one of the risks to 50 things to do, but also one of the great opportunities I think that 50 things has in our communities. And I think one of the things that I was challenged with setting up a new service in the hospital was that actually, are our services, are our interventions, are our tools that we develop actually the things that are hard to reach? And that's a real challenge. But what 50 things has, I really do think, is the ingredients for real authentic engagement in the community. And I think 50 things have already started to do that really, really well. And when I say the ingredients that are really important, I think 50 things have been engaging, as Christian mentioned, with local people, and has been born out of a school, an excellent school, St Edmunds, in an area of significant social and economic deprivation. And many of the, or probably all of the different 50 things have been developed with children and young people and families in local areas. I think one of the things also is the way it's trying to spread the message through many social networks. So we're talking about social media, Facebook and Twitter and Instagram and all those things, but also within relational social networks, which is fantastic. And I really like the way that 50 Things also links into public, private, non-profit institutions, which are developing in local communities, using physical and economic resources of local places. And I think one of the really interesting features of the tool is that you can share your experiences with other people in the community, building that sort of community relationship and sharing good ideas and creativity, which again is very energizing for people. And Many of you on the call will know about the work of asset-based community development, and also you may have heard Cormac Russell. And I really like, his phrase, which he often says, that we need to focus on what's strong in our communities and not on what's wrong. Yes, the Child of the North that was released yesterday. Some of you may have seen Christian actually on Look North, talking about it. Yes, we do have lots of problems in the North. There's a lot of inequality. There's a lot of inequality within places in the North. In Bradford, there are very, very rich areas, very, very poor areas. But actually, it is up to us to really think about how we do it. We can't wait for government to make big changes. We have to be doing it in the communities. And I think how we do that is not think about, what's not working in our areas. We need to be thinking about what's actually strong, what are our assets, and then bringing all those things together. And I think 50 Things, again, is a great platform to be able to do that and to just share what's happening in our communities, what's really working well. So many of you work in sort of organizations that are quite complex to navigate, and it's no wonder. I mean, professionals don't know how to navigate sometimes our organizations, so it's not surprising that our communities and families don't know how to navigate it. But this is just an overview of how the integrated care system in West Yorkshire works, and just to show you where 50 Things sits. So it's Children, Young People and Families Programme Board at our integrated care system. We're very privileged in West Yorkshire to have a programme board just dedicated to children and young people. Many integrated care systems around the country don't have one, but I know NHS England are really pushing for all ICSs to have that. And in West Yorkshire, we have several different work streams, and 50 Things sits under the Best Start work stream. I lead the Children's Healthcare in the Community, or CHIC, work stream, and many of the projects that we are involved with could really link in really well with the 50 Things and actually interact and help develop. And I think there's quite a lot of interaction between our work stream certainly and the 50 Things, which will work for both areas. And in Bradford, as you know, we also run the Born in Bradford programme, which is trying to link health, education, social care, justice systems, everything together to have a sort of holistic vision for young people and families and communities, which I think, again, this forms part of the foundational structure of that in the future. And as I said, one of the things that we developed in Bradford was a hospital at home service to look after children who are acutely unwell with common conditions. It's called the ACE service. And when I first heard about 50 Things, I was sort of thinking about the children that we see in that service. And most of our children come from Bradford City, which has high rates of socioeconomic deprivation, and the majority of my children are under 5. And I was speaking to my team and saying, how can we interact with this 50 Things tool? And they, the moment I mentioned it, they said, let's do it. Let's we give the acute health advice, we give the general health prevention advice, but actually we signpost them to the 50 Things and what's available in their area. And it's that constant discussion and engagement with the 50 Things in various different settings, which I think is going to be really important in implementation in Bradford and other areas. I also just wanted to highlight you to 2 other projects or programs that are running in the UK, which are also replicating, like 50 Things, replicating in other parts of the country. 2 other projects running that I think, again, would link really well to the 50 Things. So some of you may be aware of the Connecting Health for Children, CC4C, Connecting Care for Children. This is a program that started in London and is really moving pediatric specialist services out into the community and looking at how partners in education, in public health, in primary care, and pediatric specialist services can actually work much more collaboratively in a much more holistic way to improve the health and well-being of children, young people, and families. And what they found is really that when you practice holistically in this way, you actually reduce the number of acute presentations to hospital, to A&E departments, and also reduced appointments at GP surgeries. So it's coming up with some really amazing outcome data, and you know, clearly more and more places around the country are going to want to use that model and adapt it for their own place. But again, I think 50 Things really will interact well with that. And then in West Yorkshire, like in many other places around the country, we are adopting the Healthier Together platform. This is a platform that was set up initially in Wessex to try and provide consistent health advice across an integrated care system, so that children, young people and families were getting the same advice when they went to their GP, when they went to their hospital, when they phoned NHS 111, they would be getting exactly the same advice. And now this platform is really branching out into prevention and health, health improvements in communities. And we are hoping to have this platform in West Yorkshire, but also adapt it according to local projects. And we're hoping, again, to link in with 50 Things to try and see how we can interact with both these projects and tools to make both as effective as they can be. So really, in conclusion, I would say that 50 Things is an absolutely fantastic resource, and I would hope that everyone on this call will be planning to take it up. I think for me, its real benefit can be seen in our most vulnerable neighbourhoods, where there is significant, socioeconomic deprivation. I think how it's implemented will be really a critical factor in its success and sustainability in the long run. And I think that's going to be based around developing strong relationships in the community with children, families, and young people, but also with all those other organisations, businesses, the local assets that I mentioned before. But I think it's an absolutely fantastic resource, and I would really recommend it to all of you on the call today. Thank you.
Thanks, Matt. You are able to stop sharing that screen now, and I'm going to look to any questions that we've had coming through, and see that we have none. Do we have anyone from anybody on the call?
If I could just check something, Chris, if I may. Matt, I was really interested when you drew out something that we promote in 50 Things, that serve and return. But I've known of parents who felt that it's really important to try that conversational exchanges with their children in English, even though maybe they're less confident than in the home language. Do you have a view on that?
Yeah, so the serve and return is a really important part of the 50 Things, and it's an essential component of development. And it doesn't have to be in English. It can be in the parents or carers or families' home tongue. But also the important thing to remember is that serve and return is not just about verbal communication. It's also about non-verbal interaction. And so yeah, absolutely, any way of showing that you're responding to the child's cues in a nurturing way is going to help with that brain development. And certainly 50 Things is all about verbal and non-verbal, the nurturing, which is so critical.
Yeah, that's really helpful. Thank you, Matt.
Thanks, Matt, for that contribution today. I'm just reading off some of the statistics from that Child in the North report. Children in the North, and I describe them as being in the North as a kind of really as a proxy for growing up in poverty. So, and obviously not all children in the North grow up in poverty, but equally poverty is present right across the country. So really, when you're describing a child of the North, there's seminal report here, When we describe those children, it's around children who are growing up in poverty, and the facts are really quite bleak. Your 27% of children in the north of England are likely to be growing up in poverty against 20% in the rest of the country. More likely to die, significantly more likely to die under the age of 1, more likely to have missed school, more likely to be lonely and presenting mental health challenges, and also more likely to have been brought up in a household where the parent is experiencing loneliness, more likely to be in care, significantly more likely to be obese, inactive, food insecure, and impacted by tooth decay. Now, that 50 Things is, an attempt across all of that to try to flip that dial, and it will take time and commitment and partnership working to achieve that. But it is a step in the right direction, but it's against some really very powerful data which suggests that this is not a problem that is one which would be helpful to move on. It is a life and death issue, and moving on improving early childhood health is significantly important, and it will save lives. It's against that kind of powerful backdrop that we're trying to work. And those concerns have been the case for all of this century and for much of the post-war period, but they are increasingly the case for disadvantaged families now, and have increasingly got worse as a result of the pandemic. Matt, thank you very much for your time this afternoon. I'm going to hand over now to Angie to talk about some of the wonderful work that's been done in Wakefield local authority.
Okay, everybody, hello and welcome, and I'm very pleased to be here. I work in the health improvement team, which sits in the arts, culture, leisure, in the regeneration directorate of Wakefield Council. We don't sit in public health, but we are funded by public health, so we work very closely, very seamlessly with them. Within our team, within the health improvement team, I lead on the early years and families section. And our aim is to support families to be more healthy and more active. And I'm also the 50 Things lead for Wakefield. So today we're going to talk about one of the strategies that we use to be able to address some of the public health issues, and that is health by stealth. So I'm just going to give you some examples of the things that we've done in Wakefield and how some of these link to 50 Things. So let me just move on. So one of our primary aims is to encourage early healthy habits and to improve physical activity levels and to reduce obesity. And you can see the reasons why, which has just been touched upon by Matt and by Chris as well, that the data shows that children are not being physically active. They are becoming more obese than what they should be. Under 5s, recommendation by the Chief Medical Office, should be doing 3 hours physical activity per day. Now you hear a lot of people say, well, toddlers, preschoolers, they don't ever stop moving, but actually the results and the data says different. So that obviously has a knock-on effect to obesity rates. And we appreciate that there is obviously many other factors that are involved regarding these issues. So well-being, economics, nutrition, and a lot of the things, again, that Matt's just touched upon. So as you can see, the data there in Wakefield, like Bradford, it's not great. So we look at what strategies we can do to support that and to have an impact on that. Much of our role within health improvement is around prevention. Therefore, for us, it's important to see the changes in the data as the children grow up. So as you can see in the data as well, children age 6, they should be doing 1 hour, like age 6 and above, sorry, should be doing at least 1 hour's physical activity a day. But there's some that are still not reaching those levels. And once again, that has a knock-on effect with the obesity levels as well, and when they're measured in year 6 as well. So it's important for us to see that change and see if we can prevent some of those things happening and try and install some early healthy habits, which is why 50 Things is also a big asset to Wakefield. And we know how important physical activity is, and if you develop good habits when you're younger, you're more likely to be physically active when you're older and have fewer health problems. So again, it's about installing those early healthy habits. So health by stealth, what is it? I'm not sure if we quite made it up in Wakefield, to be honest, because I can't find an exact definition for it. But health by stealth is taking part in an activity, and health benefits are not the primary aim for the user. So this approach sort of attracts people to an activity through appealing to their interests, their passions, their intrinsic motivation, and through that they then engage in physical activity. So I'll give you some examples about what we've been doing in Wakefield. So our health improvement team, along with other partners, have developed many adventure trails and story trails over the last, I don't know, 4 to 8 years, I think it is. So we have 4 at present in Wakefield. We have the Gnome Roam at Newmiller Dam, whereby you can walk around and see different gnomes, and they have character names. They tell you what they like, what they don't like. At Pugneys Country Park, we have the Blown Away Story Trail, and that's currently just been revamped to be a bit more attractive to the early years. That book was wrote specifically for Wakefield and for Pugneys. Anglers Country Park, we're very, very lucky to have the Room on the Broom Trail, obviously the book written by Julie Donaldson. And then the Parks and Countryside team designed the Peters Peregrine, which is at Pontefract Park, and it just goes around the racecourse there. And some of these are in the process of being revamped, and you know, some of they get very, very well used. We also previously, prior to COVID, we led on some nursery rhyme walks whereby parents would come along to the parks, and we'd walk around the parks, stop at certain points and sing nursery rhyme songs and play games and everything. And we're now aiming to develop these into some self-led ones with fairy doors. So again, people can get out and about to the parks and engage in these activities. So these trails, these adventure trails were designed and developed with the idea of wanting to get people more physically active from our point of view. However, the attraction of many of them is not to walk 2, 3, 4, well, 1 or 2 miles around Pugneys or whatever it may be, but it's the stories, it's the characters, it's the interaction, and all these elements help children to move along a little bit more excitedly. We know the amount of times that you take children for a walk and you're like, come on. Whereas with these trails, you see children running to the next statue, to the next element, and it makes that family time a little bit more fun and exciting and a bit more engaging with one another. So I'll just give you a couple more examples of what we've been doing. Let me just move this along here so I can see. Now, love exploring. As much as we don't want people on technology, we sometimes have to go with the flow of, actually, that is the modern way. But we're doing this in a sort of clever way of, actually, we use the technology to get them out and about, to get them more active. So love exploring is the one here with the dinosaur. Is an augmented reality where you see characters pop up on your phone as you walk around the green spaces. And the joy of this is that we can plot these anywhere. We've got a lot of these in local parks, so they're a lot more accessible rather than the adventure trails are in some of our sort of destination parks. And it's the same approach. The attraction is finding dinosaurs, fairies, planets, or answering questions on the trail to be able to complete the game. They're not necessarily thinking about going for a walk. And recently, during the October period, during Halloween, we had some Halloween characters, some skeletons coming up dancing and things, which was fantastic. And those were plotted in and around the markets, so in and around the town centres as well. So it doesn't have to necessarily be green spaces that this sort of strategy is used. And then more recently, we've started to embed 50 things into one of our new leisure facilities. It's called Aspire at the Park. So what we've done is, as you can see from the image, there's my son and myself. We've got materials that children can come and engage with while the parents are having a coffee. But one of the sort of clever things that we've done, and we hope to expand on this, we've designed a map of the 50 things activities that you can go and find and go and do and tick off in and around the facility and around Pontefract. So they may come to the facility, I don't know, to get a coffee or to go for a swim or to go climbing or whatever it might be. But actually, they can extend that day, and they might go around the race course, and they might do the story trail. They might go off to find the post box. They might go to the library, to the museum. And that's the beauty of 50 things, because it has that such holistic approach. We can really grow something from being small. It can begin to really expand. So all of these approaches and these projects that we've done in Wakefield, it gives people the time to sort of explore open spaces, which is fantastic for well-being. It's fantastic for physical activity, and potentially visiting new places, learning new things, and making walks more enjoyable. In terms of, I know people may ask about measuring, it is hard to measure the impacts that we have on these, and we know we're only, a drop in the ocean to making some of these changes. But we do get a lot of quantitative feedback about the use of the trails, and people post things a lot on social media. And also at the adventure trail sites, we have people counters, which are placed around where the story trails are. So we do get a little bit of feedback. So how does, oh, hold on a second, that's not moved on. There we go. So how does 50 things benefit, support, and enhance these projects that we've done in Wakefield? Well, it's enabled us to widen our vision, and to see that we're not just talking about physical health by stealth, but actually the wider health benefits that contribute to development. So the trails really encourage that serve and return that we've just been talking about, that invaluable parent-child interaction to enhance that speech, language, and communication development, and for them to learn about the wider world. In addition to that, we're able to add the trails onto the local link section. This is such a great tool on the app. And to be quite honest, we're quite torn as to where we put our story trails and as love exploring and things like that, because they fit into so many aspects of 50 things, which I'll touch upon in a moment. So also through myself developing and the team developing the 50 Things project in Wakefield, we've developed many strong partnerships, either those that are directly involved with early years or wider partners, which is highlighted at the end of my presentation. And having developed these relationships and these partnerships, we've also developed trust and a community around the opportunities that we offer families, especially those in the sort of more deprived areas. So they're now seeing that these are, I suppose, official tools. These are really good tools that they can use. And also, because of 50 Things, these projects have been able to reach the under fives markets via social media. This is not so much a market that we've really touched upon previously. So 50 Things has enabled us to reach out to those families via social media, raise our engagement with them, and start linking our activities together on our Wakefield Wellbeing website. As I said earlier, it's given us a holistic view of what these trails offer, and it backs that the trails are more than just a walk, they're more than just a trail to find characters. It shows that they hold a little bit more depth in supporting children's development. So on the flip side, how do the projects benefit 50 Things? These projects essentially, they offer that opportunity to experience the activities of 50 Things and hopefully tick them off, which is what we'd like them to do. They stick with the ethos of being fun, accessible and no cost, and especially love exploring. It's local in terms of accessibility. As you can see, the activities with the green ticks here, these are the ones that you predominantly expect to relate to the projects that I've mentioned, particularly the adventure trails. However, the beauty of 50 Things and these projects is that they can jointly extend the experience. So all these other activities over here that you see, they can extend that visit. They can then, oh, okay, we've done the story trail, but actually we're going to have a picnic. Actually, we're going to go find some bugs. So it's amazing to be able to use the app and want them to use the app so the children get more experience and more opportunity. So we're really like sort of putting the opportunity out there for them. And as we move forward in Wakefield, there's going to be a lot more cross and joint promotion between the trails, Love Exploring and 50 Things, so we can really show that whole family offer. So just the last section, just conscious of time. So that just kind of touched upon the sort of health by stealth approach that we have taken in Wakefield and how it links in with 50 Things. But just to touch upon 50 Things in Wakefield has been quite a success so far. But we also see that as a health by stealth offer. As much of the time, you tend to promote it and sell it to parents as an app with loads of activity ideas to do with your child with local links. But actually, while the child is experiencing those activities, their brain is developing, they're enhancing their well-being, their physical activity levels. So we can use it in that way. In Wakefield, we've been really lucky to have senior buy-in to the 50 Things app. The Children's Board have put it as a priority, and Public Health have really bought into it. And because of that, 50 Things now sits as a key item on these strategies and approaches. So it is a priority in the early years strategy. I won't go into it, but the link is attached there, and you can see the headline indicators down at the bottom as to what's in there. It's also part of the Wakefield Families Together. So this is a platform that's looking to bring services together to be more integrated and more accessible for families and to make it a little bit more understandable. And 50 Things sits in there as well. And recently, Public Health have been developing the speech language communication needs pathway. And again, 50 Things sits in there as one of the universal offers, which is fantastic, because then it really reiterates to partners and services out there that this is a tool that we really need in Wakefield to support children's development. And lastly, we're currently developing the Born and Bred in Wakefield, so hopefully 50 Things is going to sit in there as well. And I'll just I won't talk about this, but these, sorry, I've lost it, there we go, it's at the bottom. And these are all the different partners, I hope I've put them all on there, that we've been working with in Wakefield in relation to 50 Things. So once again, it shows you that diversity of 50 Things, how holistic it is, how you don't have to be an early years partner to sort of deliver 50 Things. You know, I come from health improvement, working at sort of 5 and above previously, but it's worked for us. I think I'll stop there. Thank you.
I'm just blown away by the breadth of that and the imagination and determination you've shown there to get things to where they are so quickly. I mean, it's off the back of, you know, a really good team approach in your locality. That was great, I thought. Thank you so much, Angie. Andrew, anything you want to draw out from that?
Yeah, just really those story trails and activity trails, that idea of keeping children physically active, but whilst having fun is a basic premise of 50 Things. And I think Wakefield have demonstrated that level of involvement and level of leadership involvement in Wakefield is really paying dividends. And of course, the fact that Angie does such a good job of forming relationships more widely and promoting 50 Things. Thank you so much, Angie. It's grand.
And offer of email contact details there, but if anybody on the call, or more importantly, those people who are accessing the call recorded afterwards, anybody wants any more information from Angie, just to reach out to us and we'll put you in contact. But there's some fantastic stuff there, really amazing set of resources, and one of our very best local authorities is doing such wonderful work there.
And terrible jaws. I have terrible teeth. And terrible teeth.
Good, mix, mix. Mama, bubble. Wow. Bubble. Mix.
Come on, pie. Big elephant. And big brown bear.
And what happened?
And a big brown bear.
Tell Molly.
Big brown mouse.
Wow, that was a big jump.
Ooh. Shall we do something? Oh, we could splash. Put our hand in. We're mixing.